to go ahead and get started. And then as more people join, they can join us. So first, I want to thank everyone for joining today. And I believe I'm going to have an AvMed representative supposed to be joining us as well. I don't know that I see them on the call yet, but maybe they'll join us here in a few minutes. But basically, we're going to be talking about getting the most out of your AvMed plan for 2026. And the reason so basically what we're going to talk about is a bunch of stuff, but I want to share about why I'm doing this webinar and why I thought it was important to do this webinar. Because every January, we all know that plan benefits change. So whether you've been on AvMed before or whether you're new to AvMed, the plan benefits are going to change. And so we get a lot of questions in January when people go on the plan for the first time, and we want to try to alleviate some of the headaches and the challenges that people have when it comes to their health insurance and how to use it, and really what health insurance is all about, and the things to kind of look out for. So I decided to do this series. Okay, I'm going to keep everybody on mute, and then for now, the time being. And if you have a question, you can come off of mute once we get to that point, once we get to a point that you have a question. So first of all, I mean, obviously we all know that health insurance is very confusing. I mean, it's constantly changing, and especially when it comes to the marketplace, we know that the government can continue to change things on us, and we don't really know exactly what's going to happen for this year, if anything different is going to happen for this year. And we'll, of course, keep you up to breast with any changes that are taking place. But we know that it's not easy to navigate on your own. But we're going to walk you through how to use your benefits and avoid the common problems and know where to go for help. So just know that this seminar is only going to be very generic. So meaning we're not going to be going over your specific plan benefits. We're not going to talk specifically about your prescription drug benefits or your co-pays or those kinds of things, because that's something that we need to do more on one-on-one, because everyone lives in different areas and they all have a different situation. And so it's going to be more general of stuff that people can take advantage of, and that will help with understanding building a good foundation for you. So we're going to talk about how your plan works, how to access your account, things that you can do with your portal, what to do when issues come up, and how to find care, and things along those lines. Now, I do want to make sure that people understand that there are some changes happening for 2027 that, unless things change on the government side again, that you really need to be aware of and start to plan ahead when it comes for 2027. So for 2026 and for years previously, the marketplace open enrollment period ended on January 15th of each year, which is one reason why we're having this webinar later in the month of January, is so that way people are they're kind of done with choosing their plan and already on it because of the open enrollment period ending. Well, for 2027, the open enrollment period is going to end for everyone nationally December 15th, 2026. So that means we only have 45 days, because it opens November 1. We have 45 days to re-enroll the whole nation with their marketplace coverage. It's not very long. It's not enough time, honestly. I mean, even the time frame that we have at the moment is not enough time to do renewals for everyone. To make it even more difficult, they are not going to be actively renewing anyone on a health plan for next year. Again, this stuff is subject to change, but as it sits for right now, there will be no auto renewals. That means if you do not actively meet with me or my team or someone to go ahead and help you through renewal, you will not have insurance in 2027. Okay, so it's going to be super important that you pay attention to the notifications and that we send out to you, and get your information to us early so we have time to meet and make an appointment. That also means that you're going to have to do more homework prior to meeting, because we're not going to have time. The time, I mean, some of you only had a 30-minute appointment, and that was even cutting it close. But I anticipate that the meetings are going to have to be more like a 15-minute appointment. So you're going to have all the stuff situated that you need to know when it comes to your income, when it's going to come to which doctors you are specifically going to, and what plan they accept, because we won't be able to have time to research that when we go ahead and do the renewal for 2027. So I know this is not ideal, and this is not how any of us want to work, and especially with how confusing this stuff can be. But it's going to be important that you do this in order to be able to make sure that your plan is going to work for you for next year. Because once open enrollment is over, you're out of luck. Your coverage, you're stuck with that coverage for the rest of the year unless you decide to terminate it. So you can't just go in and change your plan anytime you want to. But today we're going to go ahead and start talking about one of the basic foundations of what people do not understand about health insurance. And that is health insurance is really meant to be for those large unexpected costs. The reality is if you really needed to go to the doctor, you could probably come up with the money to self-pay to go to the doctor. Now, I mean, granted, if you have chronic conditions and you're going to the doctor every week, it could become very unaffordable for you, right? But if you're somebody that's, I only go to the doctor twice a year, you could find a way to pay for that. But that's not what insurance is for. Insurance is to protect against those large unexpected costs. Whether you end up getting a chronic condition that's very expensive, or you end up, with cancer or having a heart attack or a stroke, or just major things. You have a slip and fall injury, things like that are going to impact you greatly, and that could cost you even millions of dollars. Having a child, whatever it might be. So that's what insurance is meant to be for. And so a lot of times when people meet with me, they're always like, well, I'm thinking about canceling my insurance because I don't go very often to the doctor and I can just self-pay. But that's not what you're protecting against. That's not what insurance is protecting against. So just keep that in mind as you go throughout the year, because there's going to be times where you're going to maybe you might question, depending upon your situation, on whether you should keep your insurance or not. So health insurance is not prepaid health care. What that means is that it is financial protection against those large unexpected costs, but you're going to be paying, besides your monthly premium, you're going to be paying for your services. So even if your premium is very low, maybe even $0 a month because you receive a subsidy, you're still going to pay for the services that you use, because the care is not free once you have the plan. When you actually use the coverage, you're going to be paying your premium. And then you're also going to be paying, on top of that, a copay or a coinsurance. Or you may have to meet a deductible first, depending upon the service and how your plan is specifically designed. So a copay is a fixed dollar amount. For example, it can be $0, $25, $50. The key is that it's predictable. So it's a predictable amount, and coinsurance is a percentage of the cost. So when you have a coinsurance, that means that instead of a flat dollar amount, you're responsible for paying a portion of the allowed charge, which is like a percentage. It could be 20%, it could be 50%, it could be whatever the percentage is that it shows on your benefits. So some marketplace plans are going to use mainly copays, and some use mostly coinsurance. And some are most of the time you're going to see a mix. You're going to see that that a service might sound similar in cost, but it can have very different amounts. So one of the most important protections, though, that you'll see here is listed at the bottom. And this is your maximum out of pocket. It's often called the MOOP, M-O-O-P. So your MOOP, or your maximum out of pocket, is the most you can be required to pay out of pocket for covered in-network services in a calendar year. So on a marketplace plan, medical and prescription costs are combined into one maximum out of pocket, not two separate buckets. So the things that count towards your maximum out of pocket are going to be medical copays, medical coinsurance, prescription drug costs, covered inpatient, outpatient services. And things that don't count towards your maximum out of pocket is going to be your monthly plan premium, right? That's not counting. The services that aren't covered. So if you're like doing a service that is not covered by the plan or covered by the marketplace, that would not count. Costs outside the plan's network or rules, and would it count as well? And then just know that once you reach that maximum out of pocket, your plan is going to pay 100% of the covered in-network medical and prescription drug costs for the rest of the year. So this is a big deal because people often misunderstand it, So it's important to know what your premium, your deductibles, your copays, and your max amount of pocket are on your plan. Because the reality is that when you go to the doctor, when you go to the facility, when you're getting a prescription filled, if you've already met your max amount of pocket for the year, you don't want to be charged, because then it's going to be a nightmare trying to get that money back, because you've already met your max out of pocket. So you should kind of have an idea when you go places of how much you're going to pay. Do I need to pay my deductible still? Have I already met my deductible? Am I just paying a co-insurance? Because if you're paying a co-insurance, the doctor isn't going to charge you when you go to the doctor's office. They're going to say, oh, yeah, we'll bill you. We'll bill you for that. But if it's a copay that you owe, let's say it's a $25 copay that you owe, then you're going to have to pay that copay first before you're seen. But if you've already met your max out of pocket, you shouldn't be being charged for that copay. So you need to understand where you stand, so that way you're not paying charges that you shouldn't need to worry about. So that's a little bit about how insurance actually works. So we're going to talk a little bit about, benefit systems, deductibles, rules, and then common misconceptions for health insurance as we kind of go through this. Someone has a member account, and you can access that through the mobile app, online, through the website. We'll also discuss, resetting your password and what things are available to you inside your member account. So the first thing is that when you are you're creating a member account, you're going to go to the website. It's just member.avmed.com, and then you can sign in. Click sign in. You're gonna, if you have not registered yet, you're going to have to register first. Otherwise, you can just put your username and your password in, or if you forgot your username and password, you can reset it here by clicking on one of these links. And then for registration, it's going to require your first name, last name, your date of birth, and the last 4 digits of your social security number. And so that's how you can register your account. And then once you register your account, it's going to give you, once you're inside there, you're going to be able to see, you view your claims, you can pay your monthly premiums, you can see the copies of the explanation of benefits, which I'm going to go in detail about here in a minute. You can see your summary of benefits and coverage, which means that it'll tell you how much services cost for you, like copays and coinsurance and things like that. You can track how much you've met in your deductible and your out-of-pocket spending, so your MOOP. You can request a new member ID, or you can look at your digital card with that as well, and we're going to talk about that in a second more. You can search for providers that are accepted by your specific plan. You can look at authorization or referral information. I mean, there's a lot of stuff you can do inside this program, inside the app. So we're going to talk about physical versus virtual cards and what to do if your card is missing. And we're also going to discuss provider directories and formulary, usually within 2 weeks of enrollment. Now realize that if you are brand new to the plan and you have not paid your premium yet, they're not going to enroll you and send you a packet with the cards until you've actually paid. And just since we're almost at the end of the month of January, if you have not paid for January and February, you need to go ahead and take care of that this week. Okay, so you don't lose your insurance coverage. So virtual cards you can get through the mobile app, and I personally am a fan of virtual cards. I don't use a physical card anymore. I don't carry one around with me. I can't even tell you where my physical card is located at, because I just pull it all from my app. And if I go to a provider and they ask me for my ID card, they're like, we need to see your ID card. I just go ahead and I pull up my app, and then I email them. It's easy to email them the copy of the digital card for them to verify. So I just get the email address, and a lot of offices will actually list the email address there at the front desk, so you can go ahead and take care of that. You really don't need a physical card anymore. But you can always request one if you prefer to have one. So if your card is missing, you can always just, reach out to us. We can help with that, or you can submit for a replacement card inside your member portal. So this is the provider directory. This is kind of what the provider directory, and then first of all, so you're going to go to the link for the provider directory, and So I'm going to go ahead and choose location and plan. I'm going to choose my zip code for where my office is located at. I'll click yes, this is correct. And then I'm going to choose what network I have. So in general, most people are going to be choosing the individual market plan to choose. Now, if you are on a, it'll say it in the name of your plan, like what specific network it is, but you're going to be looking for all the individual options, right? Some people, if you have an off marketplace plan, you're going to look at the Entrust Plus POS plan, depending upon if you're on that type of plan. But for my selection, and now I know that it's going to show me the correct providers. So I'm going to go ahead and start typing in. So there's different ways that you can do it. They have some of the most common things people look like. If you want to look at behavioral health, that's usually a different separate website. If you want to look at a pharmacy or find a dentist, that's with them. Those are all separate. But most people don't have dental coverage through AvMed. Just as a heads up. So I'm going to start typing in what I'm looking for. So I'm going to type in a name. I'm going to type in the name Smith. In general, that are going to be kind of nearby. I don't know who I'm looking for specifically, so I'm going to just click search. I'm going to just search instead of clicking on one of those people, and it's going to bring up, within 25 miles there are 13 results with the name Smith. So it would bring up anything that has that it's a part of the name or it's part of the address or whatever it might be. On this provider directory, I can look and I can see. It'll tell me if they're accepting new patients. It'll tell me what kind of provider they are. It'll give me their phone number, their applications are, and it'll even show me with a map, so I can kind of look at that. And you can always update your primary care doctor through your app with AvMed. So just know that you want to check before you go to your primary care doctor, because AvMed generally, all their plans require referrals. So you have to go to your primary care doctor first for most things. You just want to make sure that your primary care doctor is updated, because we can't when we enroll you, we are not able to choose your primary care doctor. So, and sometimes I've seen this happen with other carriers in general. I mean, I don't know that I've heard about this with AvMed specifically, but it can happen definitely where for whatever reason, you are going to a primary care doctor, and 1 month it just changes randomly to a different primary care doctor. So if that's the case, I would just recommend, at least 48 business hours in advance of your appointment, going ahead and making sure your primary care doctor is showing correctly. And then so that way it has time to get over to the primary care doctor, so you're not turned away at the doctor's office. So you're going to go ahead, you'll see all this stuff, and you can click on the name and I can learn more about them. It'll tell me languages. It'll tell me, what they're affiliated with. They're affiliated with North Florida surgeons and with their different location, what kind of doctor that they are, and just a lot of different information about the provider. So that's one way that I can search for them. And then there is a list, also list map if I wanted to look at the map view. But I'm going to click on filters, and let's just say I only want to show primary care doctors, because the Smith doctor I'm looking for is only a primary care doctor. So I'm going to click on that, and it's only going to show me people that are primary care providers. All right. So you can see, UF Health, Baptist, primary care. There's a Smith. There's pediatrician. So that's one way to easily do it. Or if I'm looking for a specialty, it'll tell me all the different specialties that are applicable with the name Smith. Because if it's grayed out, obviously there's not a genetic counselor that has last name or has the name of Smith in it. So you just got to look for the correct type of specialty, or you can start to filter by the core specifically. But this is the filtering is really nice, especially as you're looking for specific providers that can help you. So this is how to search for providers. I do want to show you one other way to look for providers. Let me go back to. Let me just go back here. So another way that you can do it is you can search for types of, just type in hospital. because I want to look for hospital. And generally, when you're looking for hospital, you're wanting to look up general acute care hospital. But you can see, I mean, it does show different options. I mean, this is obviously not a comprehensive list, but I'm going to choose general acute care hospital so I can see what are the hospitals that are network within 25 miles of my zip code, and then it'll show all the different options that are listed here, so I can know. And then obviously there's next page. I can click on that and find next page that's available as well. So that's how you look up providers with the provider directory. So the next thing I want to teach prescriptions on a formulary, and we're going to talk more about prescriptions in a little bit too. Okay, so the first thing we're going to need to do is when it comes to the formulary, you're going to have to look at your your benefit summary to determine how many medications are listed on the formulary. And I should have done that, but I'm just going to show you one in general. So we're looking at, well, obviously we don't want to. And the way that you can tell is how does it have 4 different drug levels, or does it have 5 different drug levels? So most of them are going to have preferred generic, non-preferred generic, preferred brand, non-preferred brand, and specialty drugs. This is generally how they work out. So I'm going to choose the 5-tier formulary, but the best way to know is by actually looking at your benefit summary, and that will tell you. And so I'm going to choose that, and then I'm going to go ahead and I can look at pharmacies here. I can price a medication out. So let's just go ahead and we're going to price the medication out. And here I can type in a medication. So I'm just going to, they have an example of Lipitor. I'm just going to type in Lipitor. It is specifically that I'm looking for. I'm going to look for the 80 milligram tablet brand. And I'm going to put my, it doesn't really matter. This, I don't know why it's asking for that stuff, but why is it asking for that stuff? Okay, that's weird. Okay, so as a first time, they just changed their system, so sorry about that. But basically, it's going to bring up the generic drug actually for this, but you can switch. Like it's showing that it's not a covered medication. So Lipitor is not a covered medication on that. It says not covered. So I need to click on generic because that's the only option that's covered. And if for some reason I can't do a atorvastatin and calcium, I can look at what other if there's other drugs that are covered as alternatives for that medication. It would list that over here for me. But it's going to tell me basically, I mean, this is pretty specific. It's going to tell me how much it's going to cost for 1 month or 3 month supply based on my zip code. So that really helps you with understanding costs for the medication. But it also tells here what tier the medication is in. All right. It's going to show what tier the medication is in. It's a tier 1 medication. And then it can also show if there's going to be other things that you have to do in order to be able to get the medication. And I'll talk about that a little bit later. So we're going to discuss where payments are made, how grace periods work with the plan, how about auto pay, and what happens if you're late with your payment. So you can pay your bill through your member portal, and I recommend everybody do auto pay. Now you can do payments through a debit card, credit card, or direct ACH payment. And you can set that up again through your member portal. I also recommend that you make sure that when you set up auto pay that each month, just double check and make sure that the premium payment actually come through. Because the reality is sometimes things happen and it didn't work. Maybe you changed your auto pay information, you no longer have that account, or your credit card had fraud and you cancel that card or whatever it might be, and you just forgot to update it. Like, stuff happens. And if you don't pay your premium and you don't realize you're not paying your premium and it's gone by for months, you will lose your health insurance and you will not be able to get it back, even if you're willing to pay for the premium. It's just not possible unless you have a special enrollment period, and a special enrollment period is not created by a lack of payment. So AvMed does give you a 90-day grace period if you are receiving a subsidy. That's if you're receiving a tax credit, the subsidy, then you get a 90-day grace period. And otherwise, you're really looking at a 30-day grace period. So if you have the grace period, what happens is after 30 days on the plan, if you have the 90-day grace period, you are going to, all your services, all your claims, everything will show pended. Basically, it's like you don't have insurance until you've caught up your payments, because so they're they're not going to pay anything until you've made your premium payment. The best thing to do is just not to get behind, because I truly find it's a very unfortunate, but a lot of people that they choose to wait to pay their bill and they're always in their grace period, they are very likely to not ever be able to pay their bill and to lose their insurance. Because once you get behind for 1 month, it's very difficult to catch up. It's very difficult to catch up. So just be aware of that. We're going to talk about EOBs and statements. So I want you to focus on 3 things when you're looking at the slide. The first thing is that an EOB, which is an explanation of benefits, is not a bill. It is not a bill. Also, that claims take time to process, and the amounts of what you're seeing on the EOB can look wrong at first before everything settles with the claims. So an EOB, like I mentioned, is an explanation of benefits, and it's simply a statement from your insurance company explaining how a claim was processed. So it's informational, it's for review, and it's not a request for payment. So claims don't happen instantly. They're going to go through several steps from the provider to the plan, sometimes back to the provider, and that means numbers can change all along the way for you. So that's why you might see something that looks alarming at first, but later resolves once everything is processed correctly. So the key thing to remember is that you don't want to react too fast. So you want to review your explanation of benefits first, and then ask questions, and then if you even owe any money, because you might not owe any money, then make the payment. Sometimes people, they see the explanation of benefits, and they're like, oh my gosh, why are they charging me all this money? The insurance isn't paying anything on this. And it's because it hasn't gone through all the processes and even gone back to the provider, potentially for changes, to actually say if you're going to have a bill at all. So in order to look up your explanation of benefits, you can view and download them on your member portal, and you're going to want to compare the amount you owe on the explanation grid. All right. Now, this is a little bit more on the technical side of claims. I mean, there can be times where you're going to need to go ahead and input a claim yourself for some reason. And so that does happen. We can help you with that. And I don't expect you to memorize or, look at the stuff. You can reach out to us and we can assist you with that. But it's important to understand that there are formal processes and timelines that the insurance companies have in place. So in most cases, the providers are going to submit the claims for you. But occasionally, if there's a claim that ever does need to be submitted manually, the correct mailing information and the deadlines around them matter, because missing the timeline can delay or even prevent proper processing. And from a member perspective, if you don't follow the timelines properly, and it could mean that you won't even that it won't even be a covered item anymore. So the main thing to remember is that an EOB is not the bill. It's a summary for the insurance company that shows what was billed, what the plan allowed, what the plan paid, and what you may owe. What you may owe is the keyword there, may. If you actually owe the money, it's going to come from a separate bill directly from the from the provider, from the doctor, for the facility, not from the insurance company. So one of the reasons that these are so important for you to review these, and a lot of people ignore it because they're not looking at their mail, they're not going in and looking at this stuff, is that you as the consumer need to be an advocate for your own health care. one, to make sure that you're getting charged for the right things, right? No one wants to pay for things that they're not having happen. But two, maybe even more important than that is that we all have to be advocates against fraud, because fraud is killing us in premiums, and it's killing us and it's straining the system. It's causing all your copays and deductibles and all that stuff to increase every year because of all the fraud that's happening. So that doesn't mean that the providers or the facilities are acting in bad faith. A lot of times they're not acting in bad faith. It's just that healthcare billing is very complex, and a lot of it's become automated and mistakes happen. So, but if we are looking at our EOBs and then seeing what errors there are, it's going to hurt all of us, because then they can't go and fix it for us. So we just need to make sure that we're protecting ourselves and the system overall. And I'll give you an example. Like this, so there is in my area here in Jacksonville area, there is a large provider group. I'm not going to say names, but if you're following me on Facebook, I posted about it, I think, on Thursday or Friday, that the Justice Department, the government, United States Justice Department, came down and said they were committing fraud. And this is a place that a lot of people go to, and that they're committing fraud, and they charge for services that were never given, basically. And so now that provider office, it's multiple provider offices, has to pay back millions of dollars due to this fraud. And so, it's really important that we are looking at our stuff so we can help right these wrongs. And what you should be looking at when you're looking at an EOB is the date of the service. Does the date of the service look correct? Like, did it actually happen on the day they said it happened? Does the provider name make sense? Like, does the provider name match up with who you saw? Does the care that I actually received, is it actually showing on there, or is it other stuff? So if something doesn't look right, the goal isn't to panic and to not pay it, or to say, like, this is fraud. We just want to pause, give us a call. We can help understand what's going on it and see what needs to be fixed with it. So what do you do if a claim is denied, though? So this happens. So typically, with even with AvMed or with any marketplace plan, most denials are administrative. That means that they are missing documentation. Somehow there was a coding issue that wasn't coded properly, or there was something that needed to be reviewed before the service was completed, and that's called a prior authorization. So if you have a prior authorization, whether it's on a service or whether it's on a prescription drug, you need to make sure that you are actually looking at that. You're getting that prior authorization approved and completed prior to getting the service completed, or prior to getting your prescription filled. Because if you don't get the prior authorization completed and approved prior to getting it filled, or prior to having the service done, then you will not get reimbursed, and your plan will not cover it. So it won't go to your deductible, it won't go to your max out of pocket. You are completely on the hook for that charge, because the insurance company did not approve it at that point in time. So the most important thing to understand is that we need to see the documentation. They're going to send over to you why something was denied. And if you want our help, we have to have all the documentation so we can look at it and see, well, what's really missing here? Is it the doctor? Most likely it's the doctor. It's something on the doctor side of things. The doctor didn't do something properly. They coded something wrong. They didn't provide enough medical documentation to say this is something that you really need to have done. And so a lot of it falls back on the doctors. It's not necessarily an insurance thing. It's more, a lot of the times it falls back on the doctors not doing things properly. So just feel free to reach out to us, bring us all the information that you have so we can look into it and help you with getting things situated. So once you understand why a claim is denied, the next step is figuring out what your options are going to be. So a denial doesn't necessarily mean the service isn't covered. It just means that it needs to be corrected, like I mentioned, reviewed or submitted differently. Oftentimes there's going to be like alternatives. There might be a different medication that you need to try first. There also might be a different way that the service needs to be billed, or it needs to be billed through a different provider in the office, or a different location, like something like that. It might not be aligning specifically with the plan guidelines of AvMed. So, it's just, there's something that needs to change most likely to get it reviewed and corrected if it's possible. So there's situations where a claim can be reviewed formally as well. So, where maybe it needs to clarify medical necessity or requesting reconsideration if the original decision doesn't seem to match the coverage rules. And again, this is all time sensitive. And so calling different departments or guessing what you need to do is going to lead you to a lot of frustration and the possibility of missing your deadlines. So that's where we really come into play and can help you with this process. So we talked a little, we already looked at formularies, we talked a little bit about deductibles and tier levels, and then we're going to talk about a little bit more, like, this is a paper formulary, so there's also paper formularies that you can look up medications as well, and sometimes it'll have a formulary. So prior authorization, we already talked about that you can't get the prescription filled unless unless the prior authorization has been completed. Quantity limits means that there's only a certain amount of medications that you're able to get for that medication, because most likely it's like it's a narcotic, or it's highly radiation, like pills or whatnot, that you can receive per fill. So this one shows that you can only get five per each day. So I mean, I guess this is something that maybe you take a lot of, I don't know. But that's the max you could get is 5 per each day. So, this one is 4, you can only have 4 per 30 days. So you can only take this medication 4 times every therapy. So with step therapy, you're going to have, sorry, I'm having brain things here. Step therapy means that your doctor might send over a medication that he wants you to take, but the admin might say, well, before that drug is on the formulary, and it would show up as ST on the section, show up as ST. But we want you to try some other medications before we let you fill that medication. Okay, so if that's the case, then you're going to have to try those other medications, or your doctor's going to have to prove, hey, we've already tried these medications, they don't work, or hey, they can't take this medication because they're allergic, or different things along those lines. So you're going to have the step therapy that needs to be completed first before you can get the medication that you're wanting. That's a little bit about the limitations and the things that you're going to see when it comes to prescription drugs. So if your drug is not on the formulary, so we can always, definitely reach out. We can talk to AvMed about it. There are formulary alternatives, right, that can help treat condition. And if for some reason, your doctor's like, no, we can't do any of those alternatives, they have to have this one specific drug, and it's not on the formulary, then it would be a matter of the doctor providing necessity and through medical documentation to make an exception. He would file an exception request for that medication to be on the formulary for you. And just know that generally when that happens, it's going to be at a higher tier level. You're going to pay a more expensive amount of money for that, unless you're able to get a tier exception approved to drop down the cost of that prescription drug. So these, again, are the different tiers that, that are available, just depending upon your plan that you're on. Generics, preferred brands, non-preferred brands, specialty drugs, zero cost share preventative drugs. Okay. We talked about prior authorization a little bit already, and this is just talks about prior authorization and just how to navigate that if you need to. And we already went over provider search tools. We've talked a little bit about network, but the main thing to know and remember is that if you go out of network and your plan does not have out-of-network benefits, that you are responsible 100% for those costs, okay? Because your plan doesn't have out-of-network benefits, and it will not go to your deductible, it won't go to your max out-of-pocket. You're basically self-paying by going out of network. Now, if you there is no emergency room network, so you can go to the emergency room anywhere in the nation, and the network changes can happen anytime. And this is the biggest problem that we're seeing across the board with marketplaces, especially, is that the reality is that doctors can go in and out of network at any point in time. Facilities can do the same thing, and it becomes a really big problem because you might have established care with a provider, and they suddenly, oh, we decided we're not going to take that anymore. Well, that's not an AvMed problem. That's a doctor problem, right? Because the doctor is choosing that they don't want to take it anymore. And so when that happens, you don't have a choice, but you're going to have to find a new provider unless you have some sort of special enrollment period that will allow you to change plans. So just be aware that, when we sign people up on a plan, when we're looking at provider directories, and the provider directories aren't always accurate. So you got to be careful because, like, we can only go off the provider directory. If you want to talk to your doctor and find out, you're going to need to call them yourself to find out when you're looking to enroll in a plan, because we just don't, there is not the time for us to contact every doctor and talk to them about what plans they accept. That would be something that you would need to decide so we could figure out which plan is going to make the most sense for you. So, but network changes can happen anytime, even though, I mean, it's happening a lot right now where doctors are like, yep, I'm in network. They tell you they're in network. They show a network on the provider directory. They even show a network on their own website. And then when somebody goes to use it, they're like, yeah, we decided we're not taking that anymore. And we've already notified the insurance company that we're not taking that anymore. Okay, well, there's not anything that we can do about that. Like, you're going to have to find a new doctor. And the other issue is that if you, what was the other issue I was going to share? That I just lost me. I just lost it, but that's okay. The other thing to know is that if you do have out-of-network benefits, because there are some AvMed off-marketplace plans that do have out-of-network benefits, just know that you're going to pay a higher cost sharing for that, and the provider still doesn't have to accept it. So if you have out-of-network benefits and you go to an out-of-network location or provider, the doctor or the facility can be like, yeah, we're not going to accept that. You're on your own then to go ahead and file the claim. We can help you with it. To file the claim, you'd pay up front to the doctor. You'd get the copy of the claim and the bill and all that kind of stuff that you paid. You'd submit it over to AvMed, and then AvMed would pay according to whatever your plan benefits are for out-of-network. Because even though out-of-network allows you to basically go to whoever you want to, the provider doesn't have to accept it. The provider doesn't have to accept it. So just be aware of that as well. So we talked a lot about the app. We're going to discuss some wellness programs, some discounts, and some rewards. And I don't think that, hold on a second. He joined me. Yeah.
Hey, Kate, I'm here.
Oh, you are. Oh, okay, you are here. Okay.
I've been sitting patiently because you've been doing such a great job. I haven't had anything to say, but I'm here if you have any questions.
We have an AvMed rep on, and I'm sure he'll fill in. He can probably explain all this stuff that we're going to go over now a lot better than I can. But I'll do my part, and then you can fill in and say, no, that's wrong, Kate, or whatever it might be, or add on. And of course, if anyone has any questions, you're more than welcome to go off of mute as well. So we're going to talk about, hold on a second. Where did the slides go that were on there? I don't know what happened to okay, well, we're just going to talk about it then. I thought I had some slides on here that you just go ahead and you talk about it, since I don't have the slides up here and I don't know where they're at. About the wellness, like the wellness programs and things like that. I can tee you off on some of the stuff if you need help with that.
Sure. So I'll go over some of we call our added benefits.
Thank you.
The first one that I'll talk to you briefly about is actually called Smart Shopper. Now, everybody that becomes once you become an AvMed member, you're eligible for all of these added benefits. So the Smart Shopper program is something that you can sign up for through your member portal once you have the access. And it's essentially a tool that you can utilize throughout the year. for any services that you have to complete prescribed by a provider. For instance, routine things such as like MRI, well, MRI is not routine, but colonoscopy or mammogram, things of those natures that you might be conducting throughout the year that your provider often likes you to complete. Essentially, you have the ability through the Smart Shopper program to complete those things at facilities that are contracted with AvMed that will give you a cash back reward by doing them at those facilities. So how it works is basically, your provider may prescribe, for you to get a colonoscopy or an MRI or an X-ray or any number of routine sort of things that need to be completed. And once you have access to the Smart Shopper list, you'll be able to see them in there. But because there's several, and what happens is you would go in and you would search in your zip code a facility that maybe you're needing to conduct an MRI, and you type in your zip code, an MRI procedure, a list is going to pop up of all the different facilities that are contracted within the area. One of them, might be a half a mile away, and say that, if you get your MRI done here, AvMed will send you $75 back in rewards for completing at that facility. You may see another facility that's maybe a quarter of a mile away from there, and their tier level reward program may be $100 cash back rewards. So obviously those that are, doing the math and saying, okay, well, for an extra quarter of a mile, I can go to this approved facility and get it done. Why wouldn't I want to get $100 cash back versus $75 cash back? So it's a lot more easy to see the benefit and the functionality of it once you are able to register in Smart Shopper. But some of the key highlights I want to mention are it's unlimited throughout the 12-month calendar year for enrollment. So if you get let's just say an MRI this month, a colonoscopy, I keep using colonoscopy, next month, an X-ray in 2 months, something else in October, right? It'll accumulate to unlimited amount of money. So a great feature for those that have to get things completed throughout the year. And also, I did say it is unlimited. However, the one thing that you will have to keep in mind is that if any cashback rewards over $600 throughout the year, you are going to get a 1099 from the IRS. What else am I missing on it? I will tell you, essentially how it works is once you get the procedure done, right, you're going to have to wait for the claim to get adjudicated like any other process. But typically within 30 to 60 days is when that check will come to you in the mail. It will come to you at your home address, and it will come in an envelope that actually does not say Smart Shopper. It's going to say, I write this down, Zealous or Smart Shopper, or a combination of both. Zealous actually owns Smart Shopper, but I want to make sure you remind yourself of that, because it's not going to come in an envelope that says AvMed, so don't throw it away, because it's probably going to have your check in it. So Smart Shopper is a great program. We have another one called RX Saving Solutions. Great program, third-party vendor, same thing. As soon as you become eligible with AvMed, you can become registered with with RX Saving Solutions, and essentially it's a shopping tool as well, but for prescriptions. So earlier Kate was going over some scenarios of formularies and how drugs can be sort of viewed with whether it be regular, generic, things like that. So with the RX Saving Solution, it's a great tool that you have at your fingertips to be able to, especially if you're someone that has multiple medications, have access to a pharmacy technician that will actually review all of your medications for you, go through the list, give you an idea if there's any cost-effective opportunities for you, such as, can we take this tablet and make it a pill, or vice versa, or change the dosage to be able to get you a 90-day supply cheaper than a 30-month or 30-day supply. So how it works is simply the same way, right? You provide your prescription information to the pharmacy tech. They're able to go in and review, alert you throughout the year if there's a price increase. So if we'll just say XYZ medication is $10 and next month it's going up to 15 for some reason, you'll get an alert from the pharmacy tech letting you know. And then that way you can review and say, hey, is there any way to, take a look and see if there's a cost-effective alternative? Now, 10 to 15 is not a huge spread, but for some people it's a big deal. But what they'll do is they'll look at it and say, okay, we've found an alternative medication that fits the same formula profile. It's a different name or different generic. They'll contact your provider for you and say, Mr. and Mrs. So-and-so is currently on this medication, but we've found an alternative that meets the same formula of the prescription, but on a different name or different, way of taking it. And we're actually able to save them money by switching to this one. Most of the time, the provider will obviously say that's fine. Go ahead and make the change, and then the pharmacy tech will go ahead and contact the member's pharmacy for them as well. So if you have CVS, Walgreens, Publix, whatever pharmacy you utilize, the pharmacy tech will coordinate that and have the pharmacist update the prescription as well for you. So it's very user friendly. So I would recommend, go ahead and setting that up. Whether you don't take medication or hardly any, or if you take several, it's just a great tool because the pharmaceutical industry and market is always changing, and you never know when that $10 copay medication is going to be a $500 deductible first medication. So the Smart Shopper, great tool for getting procedures done. The RX Saving Solutions, which is essentially the shopping tool for the medication. The other one that I would like to bring up for those, mental health is a big topic for a lot of consumers these days. We have a great mental health partner in Optum Health. Again, I know earlier Kate had showed on the screen for provider services, where to find primary doctors and hospitals and such. One of those tabs underneath there was behavioral health. When you click on behavioral health, it will take you to our Optum website and give you the opportunity to search for, various mental health providers and facilities for anyone that needs to utilize that. Also, very good from a digital standpoint, and you can utilize it on the app on your phone. I want to circle back just real briefly because I know you had mentioned earlier at the beginning, if there was any major changes for plans this year. And I don't have any major changes to announce. I mean, there might be some little things here and there with network changes, but nothing major. But while I'm on the topic of mental health and Optum, there was one change that we are seeing for those that utilize ABA therapy services. So I don't know if anyone on the call is familiar with that, but it's typically services utilized for special needs children, such as autism and things like that. In the past, the way that ABA therapy services were billed was basically zero cost share to the member. And that has changed with AvMed. And I've done the research because we've had a few over the last few weeks from open enrollments noticing that changes are getting in the billing. And it's pretty much a common theme with all of the carriers billing the same way now, which is some will bill on the behavioral health side, but those that don't, such as AvMed, the cost share goes to on your list of summary of benefits, you'll refer to specialist copay co-share. So meaning it will be billed towards whatever the provider is on a specialist basis. So some plans will have a copay, and it'll vary between the plan. You'll need to look on your summary of benefits. But some plans have a $0 copay until the deductible is met. And so that can be a big change for some people, because those that have been used to not paying for the service that now have a deductible of, say, $8,000 or whatever it is, right? They have to meet that before the $0 co-share of the ABA therapy goes into effect. So just be aware, if anybody that on the call maybe or Kate that have clients that that utilize that service, that's a big change on billing
Yeah,
for
I
that.
have a lot of questions about ABA therapy, so that's good to know for sure.
Yeah, and the answer or the question has obviously become, why did AvMed change that? That's a product development change several layers above my pay grade. That was a decision that was made. But I will tell you, it aligns with what most other carriers do now. It's just that for those, that have been on with AvMed multiple years, right? That's a big change. So. Those are
Um,
really the three added benefits. We do have several more, but if you want, once you become a member, you can go to your portal or go to avmed.org. There's definitely a section that has a lot of other things, such as Active Fit Direct, where you can get discounted gym memberships. Chef Patty on our Instagram, who does a lot of great healthy cooking alternatives or some outdoor stuff. But the RX saving solutions, the Smart Shopper, and the Optum are the ones that we're seeing the most traffic and utilization right now.
you have a telemedicine for $0 copay too, right? Through MD Live.
Correct. Yes, our telemed provider is MD Live, and yes, there's the free virtual free virtual appointment. And then I don't know if you touched on it, but our lab services, Quest. So
Yeah.
very, very important that, if you're getting labs from a provider, that you utilize it through a Quest lab. So you're not surprised if you go to, say, a LabCorp or something and you get a bill later. But definitely, and Quest is, it's kind of like Starbucks. Like, there's one on every corner now, so it's hard not to find it. But that's definitely important to remember.
Definitely. And then you use for 90-day supply, you do it through Express Scripts.
Correct. Yep. Express Scripts, and we have pretty much any pharmacy you could think of in network. Like I said, Publix, Costco, Walgreens, CVS, Walmart. So again, you can utilize it by searching on the website there. But it's a great tool to look at, because it usually will give you, like you showed earlier, right, the alternative, pharmacies on a particular prescription and where to get it. So.
Yeah, definitely. That's really helpful. I mean, while we're on it, does anyone have any questions that specifically to AvMed before I continue and wrap up with a few other information tidbits for you all? You can just take yourself off mute if you do.
I actually be a little proactive when it comes to it. So I don't know. I think I see about 3 or 4 people on here. Is anyone on here not been able to make a binder premium, or haven't gone on to try to make a binder premium at this point? We'll start with that.
Hi,
Well,
yeah.
Hi,
I'm actually trying to do that right now, and I'm unable to do it.
Yeah, same here as well.
Are these new? Are you all new members or existing renewals?
I'm new.
It knew as well.
Okay.
Yeah, we actually ended up having to send the payment in via mail.
Okay, you said okay. So,
yeah, both for January and February.
Okay. I'll send you, Kate, some of the binder. You may have already received it, and I guess some of you that are on the call may have already received the email with the 800 number and the auto pay number.
They haven't been working. So like,
Yeah.
I talked with Jacqueline about it, right.
Yeah, so that's why I brought it up. It's an ongoing issue. Not to get too much into the weeds, but AvMed was bought by a company called Centera a couple years ago out of Virginia. They're a big healthcare conglomerate. We've been transitioning some things over the last couple of years. We did a major transition from integration, unfortunately, during the same time as open enrollment period. I say unfortunately because it wasn't my decision, so I can say that. So with that, there's been some issues with the migration integration and some challenges. So I apologize first and foremost for that. It's unfortunately not something that I can control. But please know that you can use Kate to communicate to us if you have any continued ongoing issues with that. We can kind of forward it and make it an urgent thing with our finance team. But I brought that up because there is a light opening at the end of the tunnel. We've seen a lot of the issues that are happening being resolved. Unfortunately, this one with the binder payment situation has been dragged out a little bit longer. And the reason why I asked if you're new, because it's a different issue for new members versus some that were existing and were on auto pay. So if you're still having trouble, please let Kate know, and we can address it separately, I guess, if you will.
So I'm sorry to interrupt you. So like I logged in, I got into the member portal, and then to make my first payment, I'm logging in a different place with the same login credentials that I just created, and it is not letting me in. Is there something else I should do? Should I reset my password?
For new members, there is actually a payment link. Let me see if I can.
You can probably. I made you a co-host too, so you can.
Let me see if I can put this in the chat. Let me copy it here. Oh, sorry. I'm supposed to copy here. Hold on. You just type it in. And you can let me know if this is the same one you're using. Service health plan by score. All right, so if you right now, new members can make their initial binder payment through this link. It's a link that was created specifically just to make binder premium payments for new members.
Clicked on it, but it's not working.
Yeah, maybe try it in Chrome. I know some people have had issues if they haven't done it in Chrome, and let me see if I click on what happens. I can screen share.
Come on, where's my window popping up? Over here, okay. No, I mean, if I copy paste it here, it's still not working, even in Chrome. Is it working for you when you click on it?
Yeah, it does. When I click on it, it shows. I'm gonna see if I do. You have screen share? Let's see.
Yeah, you should be able to share screens.
That cannot be read.
But if it's not working for me, even on the other things,
So this is what it should look like.
Yes.
Has anybody else gotten to this point?
Yes, I've gotten to that point, so I used the same credentials that I just created, and it wouldn't let me log in.
Okay.
So I went to the registration page and registered. I just added my primary care, but I'm following the link to pay the, and I can reset my password again. I can register again. But I didn't want to do that just in case it would confuse, because I've already registered and selected my primary care. Mm-hmm. So I can just keep trying it.
Yeah, it may not be there anymore.
Yeah, I mean, let me see here. I'm just reading. Let's see. It says obviously that requires a separate login. It's only the binder payment. It does not transfer.
Yeah. Could it be just that I was brand new and I need to wait a little bit?
No, I mean, theoretically, this was created to bypass the issue that was going on for new members to make that binder payment initial binder premium payment.
Gotcha.
So you are doing the right thing. If it's not allowing you, then I hate to be a pain in the butt, but maybe you can screenshot it and send it to Kate, and Kate can email
all
it
it says.
me.
All it says is that my my login, like it's not. There's no username and password. So I can log into the main site. I just can't using those credentials. I just can't log into that one. I don't know if that makes sense, if I'm explaining that right, but
it makes sense what you're saying. I don't know why.
Yeah.
that is the reason why, or what I should say, why you're able to do that and not do the other one.
You know what? Let me tool around with it a bit. I'm gonna try and reset my password, and then you know, I'll try it tomorrow, and then I'll give Kate a buzz and see if she
I was
can
gonna say
help.
maybe reset that and do it.
Yeah.
What I will tell you guys, and I'll reiterate kind of what Kate said earlier, which was obviously they're wanting the binder premium payment made before you'll have access to be able to register, you know, the other member portal stuff. I will tell you from a turnaround standpoint, once people have done that binder premium payment, it is usually taking 24 hours in rears for people to be able to access after they made that binder premium payment. You know, they've extended the grace period to the end of the month, which is the 31st. But I will tell you, if for whatever reason this continues to be an ongoing issue, you know, and I'm not hoping that it will be, but let's use the hypothetical that it did, and you know, payment wasn't submitted by 12/31. They're going to honor those that are obviously providing, you know, documentation that they've been trying to do it, whether that's phone, email, things of that nature. So don't worry that, oh my God, if for some reason on the 31st my payment doesn't post, I'm going to lose coverage. Obviously, if nobody did anything to try to do that, they're going to say, well, we didn't see anything. But those people like yourselves that are making this effort and it's just not happening, we'll work through that. Our team will work through that with the team that does the processing to make sure everything's okay. Because it is an ongoing issue. It's one of the major issues that we're seeing, and I will tell you that they're pretty I don't want to say they're bogged down with it, but they're pretty busy with it right now. There's just with some intertwining of back-end technology that somehow that didn't mesh, and it's different for certain people. Some people can get in and make payments, but some people can't see their ID card. Some people, you know, it's not a one size fit all issue, unfortunately. But anything that we can do, you know, like I said, if you rely on Kate and Kate needs to rely on us to help with the process, you have access to us. So you don't have to call the 1-800 numbers all the time. Obviously, they're there for a reason, but myself, I'm actually located. I'm not located in the Jacksonville area, but I'm located in Palm Beach Treasure Coast area. We have people in my position that are located, you know, they handle Central Florida, North Florida, and so the reason why our positions were created a couple of years ago were to be able to be sort of conduits for brokers and members, mostly brokers, because we don't usually give out our cell phones to members, but for brokers. But so to utilize us, you know, versus always being stuck on a 800 number, maybe for a longer period of time than you want to be. So I would encourage you that once we get past this, hopefully this will be resolved soon, that throughout the year, anything that you come across that you need, whether it's a claim history question or a billing or anything, and you go reach out to your agent, Kate, right? Kate has us at her disposal to utilize as well. And so that's one thing we are trying to do to separate ourselves, you know, from other carriers, to be able to have some of that personal touch. Not saying that other carriers don't, but just as AvMed is a regional carrier, we're not a national carrier. We don't have, you know, thousands of employees, but we have a lot of employees strategically placed throughout the state to make sure that we're able to help with these things throughout the year for you. So please share all the information that you can, and we'll take care of it as soon as we can on our end.
Yeah, and that kind of brings me up to the next little section here. I'm going to share screens again real fast. And we'll kind of wrap things up. So where are we? Okay, so I wanted to talk about who to call and when. So basically, one of the things that I get questions about is, you know, everyone wants to, I probably am the person that enrolled you in the plan. I mean, granted, I have other agents that work in the office with me as well, but I'm probably the one that enrolled you in the plan. And I mean, it is my agency overall that I own. But what do I specifically do, and what do my other team members specifically do? So we have something called the Mirror Care team, and they're the ones that are going to answer all the phone calls. So you'll never really get me on the phone ever unless we have a scheduled appointment, or unless for some random reason I need to call you for something, and it can't wait till an appointment or something like that. But every phone call is going to be answered from 8 a.m. to 8 p.m. Monday through Friday. Those are our hours that we operate, and here to help people. Granted, because we're helping people that are in other states as well, and so we try to be open kind of like a 9 to 5 for everybody, depending upon whatever your time zone you're located in. So if you have questions about claims, or you need help with claims issues, or there's prescription drug issues. Now I know that we talked about the RX savings solution, but we also, if you have medications that are expensive, I have at my fingertips a special database that has nothing to do with health insurance, and this is free. That we can do this for you. We can get all your medications, and we can send over to you a list of every single patient assistance program, grant, discount card, Canadian pharmacy, all the different options that are available for those medications, along with the applications, like what the qualifications are to apply, all that kind of stuff that you might want to know about for your medications. Because just because you have healthcare through AvMed for medications, doesn't mean that all your medications are going to be covered on the formulary, but two, depending upon what your benefits are like, it might just be really expensive for you to get your prescriptions filled through your plan, and you might be better off to see if you can get something covered through a grant that you're not paying anything for. Like I know that for myself, my son has a very expensive medication that he takes, and so we actually qualified for a grant, so he's on a grant for it, and all the money that medication costs goes to his max out of pocket. And he reaches his max out of pocket in like a month for that medication. So we're not paying anything for it. And then he's met his max out of pocket for the year for everything. So it's been really beneficial for us. So if you have medications that you want, now if we're talking about like a $5 generic, I mean that's not what this is for, right? This is for medications that are more on the expensive side of things. Just reach out to us and we can go ahead and pull a report for all your medications. But you'd have to give us all the details for it. The other thing that the Mirror Care team can do is they can help with answering benefit questions. Now, they're not licensed agents, so they're not going to be able to compare plans from one plan to another, but they can help with answering your benefit questions. They can do a 3-way call, and like was just mentioned, we don't want to make sure that you call us first before calling the insurance company, because oftentimes that creates a lot of frustration. And so I don't encourage calling the insurance company first. Let us see what we can do to help you and make it a lot easier for you. If something doesn't feel right, like you just think that something's off, just give us a call as well. Now, things that I get involved in is when it comes to enrollment change, helping you understand if you even have a special enrollment period, if you want to look at other plans, or like, I'm not talking about like necessarily medical plans, like health plans outside of AvMed. I'm talking about additional products and things along those lines. And so just please reach out to us, make sure, and I'll talk about some of the other products that we offer here in a second, but make sure that you contact us if you're unhappy, because the reality is the way that the marketplace works. We already talked a little bit about fraud, and we're going to talk about it here more in a second, but if you end up being unhappy with your plan, we don't know about it, we can't do anything to help you out. So ignoring it is just going to make it a worse problem. And there is a lot of fraud still going on. So when it comes to fraud, especially with the marketplace, it's important to look at your healthcare.gov notices that you receive through the email and text message. If it shows that your plan has changed, or it shows a different agent of record on there and it doesn't show who signed you up, that's a problem. Because what happens is that a lot of people go on Facebook or these different places and they're like, oh, this is a cool survey I want to fill out. Or, oh, wow, look at that deal. That's an amazing deal. Like they're going to pay me $1,000 a month to go on this insurance plan. I want to learn about that option. Or just, there's this game that they fill out this information about. And what people don't realize is what's happening is in the very fine print of what you're filling out, you're giving consent to an insurance agency somewhere to go ahead and change your plan. So you all are familiar with that. When we do an application, every time I touch your application, you have to complete the consent form again. And that's how it's supposed to be. But when you give your consent to a different agent, if you don't revoke that consent, then you're going to have a lot of problems with your health plan, where they change your health plan somehow, they cancel your health plan somehow. I mean, I see it happen all the time, and sometimes it's a nightmare to fix. I mean, it can take months and months to get it fixed, if it's even fixable. So sometimes we can't fix it, and when that happens, when you have a different agent that comes into play, then we can no longer help you, and we won't be able to take you back as clients. So just be aware that if it sounds too good to be true, call us at the minimum, or just know that it probably is too good to be true. So just don't believe all those things, regardless of how good it sounds. So other ways that we help people is we offer life insurance. So even if you have a spouse that's working and they have life insurance being offered through there, it's really important that you get coverage outside of your employer, because the reality is that insurance is never going to be more affordable for you than it is today. So the longer that you wait to get life insurance coverage, the more expensive it's going to be, and eventually you're going to retire, and your benefits aren't going to go with you. So yes, some retirement, like some retirement companies offer you to, hey, they'll let you go ahead and renew your plan, but it's like 10, 20 times the cost of what you're paying. It's like crazy expensive for this low benefit, and it's not worth it. Whereas you could get a life insurance policy that can stay with you for the rest of your life, whether we look at a term policy that's a lot more affordable. There's different types of plan options depending upon what you're trying to accomplish. But it's really important that you look at getting it now, because you might not be able to even qualify medically to get life insurance down the road. So I encourage you not to just only have life insurance through your employer. The other thing is that hospital, accident, cancer, heart attack, and stroke coverage. Now, people always say, like, why would I want to buy additional coverage outside of having my health plan? I'm already paying all this money for my health insurance. It should cover all this stuff. Well, it's not that it doesn't cover all this stuff, because it's, AvMed's going to cover if you're hospitalized. I mean, you get cancer and you have these medical things that happen to you. But the reality is that that's not your only expense, is not just what you're paying for maximum out of pocket. So let's just say your max out of pocket is $10,000. You will actually, I mean, most people don't have probably $10,000 that they just put aside in case they ever have to reach it, right? Like, they're not, you could probably come up with $10,000 if you need to, but you don't probably want to use that money to pay your max out of pocket. That's one of the ways that these plans come into play. So they pay you money that you can use to pay your medical expenses. Additionally, your AvMed plan isn't going to pay for the things that aren't covered by your health insurance plan. So what I mean by that is, I'll give you a personal example. A couple years ago, when my son was 6 months old, I had a slip and fall injury, and it left me where I wasn't able to walk or drive for a whole year. It was that bad. And I mean, I was not expecting to slip and fall. I was just walking into a pool, and it was a very bad accident. And so by having a plan like this, unfortunately, I had these plans, and I had my husband in charge of paying them, and he decided one day he's like, why are we paying this money? And he just stopped paying it, and he didn't tell me. So I would have probably made like $100,000 off of that slip and fall accident that I had. I'm not even kidding. And it would have more than covered for multiple years of my max out of pocket and all that kind of stuff. But but outside of the medical benefits, because obviously we paid our medical expenses and all that, But what was not covered by our medical plan was the fact that I had to fly out my father-in-law to come and take care of my children because I couldn't carry them. I couldn't drive. I couldn't take them to school. I couldn't do all this stuff. So I had to fly him out and he had to live with us for months to take care of my kids and to take care of me ultimately, taking me to doctor's appointments and doing all sorts of stuff. So, when you have something that major that happens to you, then you might have to do the same thing. What are you going to do about childcare? Maybe you're going to have all this childcare costs that you're going to have to do. Maybe you want to have someone come into your home and actually do specific care for you that's a skilled care provider. You might need to travel to a different city and for treatment that you are going to need to stay in a hotel. Those are things that people don't think about that can be very expensive that is not covered by your health insurance. So you can get these plans for relatively very inexpensive, and especially the younger you are, the more affordable it is. I mean, we pay like $1 a day for a plan. So there's definitely options out there that I highly recommend that everybody have. And depending upon your situation and where you're located at, we'd look at different plan options for you. So you don't have a plan in place, you should definitely have one. Additionally, we help with retirement and annuities. So if you you want to look at different options that are available to you, we can help with that. Social Security optimization. You might not be aware that I am probably one of the only, if not the only, registered Social Security analyst and certified Medicare insurance planner in the state of Florida. So what that means is that I help people with every kind of health insurance, not just Marketplace, but also Medicare and self-employed plans and all sorts of things. But so when you're getting close to going on to Medicare, we need to connect. But if you're looking soon to draw Social Security or thinking about like, what should I do? Social Security cannot advise you. It's illegal for them to give you advice. So I have a special software that actually I do an analysis for people on their options. And so if that interests you to be able to really understand and make sure that you're taking away the right amount of money and that you're making decisions because most people depend on their Social Security. Some people that's all they have for retirement is Social Security. So you need to make sure that it's being optimized properly because once you start enrolling in Social Security, you're basically done. You really can't make changes to it. And I also wrote a book about it too that you can find on Amazon. I think it might be the only book on Medicare and Social Security in the country. So you can get that for $17 if you'd like on Amazon. But the last thing is traveler's insurance. So if you travel out of the country, your plan is not going to follow with you. So just know that you're going to need to have traveler's insurance. And I personally have a plan that's for my family for the whole year, and I just renew it annually, and it's only a couple $100 for the whole year. And it's worth every penny because it covers all of our trips. I don't have to worry about if my body needs to come back or, that something major happens in the other country and I have to get out right away, or, I have a medical incident that I need covered. So it's definitely very important that you have a traveler's insurance policy. There's lots of different options within it that are very affordable, whether you want a single trip just for one trip that you're going on, or you want to have an annual policy, or you're a missionary, or different things like that. So just reach out to us. So just remember, make sure you're using your benefits, save your important documents. Feel free to ask us questions because we're here all year. And if there's anything else that anyone has a question about, feel free to come off on mute and feel free to ask us because we're happy to help.
I don't have any questions, but I just want to commend you for doing this. So those of you that are on the call, I didn't know Kate before this, so she didn't pay me to say this. But it's very, very unusual for an agent to be able to offer this amount of detailed conversation and service to their clients. In my experience, I have an experience as being an agent in full planning, life, disability, everything that Kate is doing. I have that background as well, and the fact that she's willing to do this type of Zoom is incredible. Number one, to cover what you're getting from a health insurance standpoint, but also to be able to show you the other importance and benefits with real life examples of why you should consider using them is very commendable. And I definitely think that you just on the hour and a half that I've been on this call, I can tell that you guys are in good hands with whatever you utilize Kate for. So thank you for allowing me to be a part of this today.
Oh, thank you. I appreciate it, especially since I don't know what happened. We added all those slides in, they're like gone. So, technology, whatever. But I appreciate
Worries. We can send some more slides on the offshoot if you want to send to them. But you
well, probably have it.
Job
I don't know if the seminar got saved wrong or something like that. It's probably somewhere else, but it's okay. But no, I appreciate all your feedback, and thank you for the kind words. I will say that I really only work off of referrals. So if you do have anyone that needs help with any kind of health insurance, because I do group benefits too, I do it all. So please send them my way. That I'd really appreciate it, the opportunity to be able to serve and help more people. And I am licensed in like 11 states, so I can help in a lot of other states as well. So if you know anyone that needs any assistance, please send them our way, so we can support them. And we want you to utilize our team, because I just think that there's just not enough education out there, and that's why I decided to do this, because people, they don't know any of this information. You have all these benefits at your disposal, but the reality is that no one, even if you don't know about it, you're never going to be able to use it. And so that's why I wanted to have this webinar, and I really appreciate, because you're the only marketplace broker manager. Well, most companies don't even have a broker manager, like have someone that helps support us. Like pretty much all of them don't, except you guys. So that means a lot to me that you would come on the meeting with me today to help people.
Oh, absolutely. There are other competitors in our market that I believe have maybe one or two people in the entire state. So, not to disparage the company, but I feel sorry for those people, because I don't know how they. I mean, I'm busy every day, and I'm Palm Beach and Treasure Coast. So, someone that has to do the entire state, I don't know how they keep up with that workload. So, but I'll just reiterate, like, if you guys have the opportunity, for any issues or concerns or good things as well. It doesn't have to be an issue, but to utilize Kate, and then Kate will utilize us, because it can be frustrating, being on a 1-800 number. And I'll tell you right now, with the as I mentioned, the level of volume of the calls for certain issues, particularly the payment stuff right now. I've had people telling me they were on hold for an hour and 55 minutes before they made a call, or before they made a payment. I don't know about you, an hour and 55 minutes in a day is a lot of time. So, if we can satisfy a resolution for you by not having to go through that, obviously that's not something we want to be continuous, and we don't anticipate that to be the case once all of it is resolved. But, you utilize us for anything moving forward, it'll be a lot easier, and we can usually, get a resolution a lot quicker, or at least the feedback to say, listen, the resolution is not going to be in the next 24 hours. It might be 48 hours because of X, Y, Z. That's a lot more comforting for most consumers, right? If I call a company, it doesn't have to be an insurance company, anything, and somebody can tell me, hey, there's going to be a resolution in this time, and this is why, right? It gives you a little bit more of assurance that, okay, everything's, going to get worked out, and, I can go on about my day and not have to worry about, is this going to get done at what time? So anyway, I'll get off my soapbox. It's 5:30. Thank you again.
Yeah, thank you all. And if you haven't had a chance to give us a 5-star review on Google, please do so. That helps more people to find us. But we're here for you, and really appreciate you being members of being with us with Mere Benefits. And I hope you have a great day.